Question 1. A client with acute heart failure is receiving IV furosemide. Which finding is the nurse's highest priority? A. Blood pressure 9/64 millimeters of mercury. B. Potassium 3.0 milliequivalent per liter. C. Weight loss of 2 kilograms in 24 hours. D. Urine output of 250 milliliters in 6 hours. Answer B. Potassium 3.0 milliequivalent per liter. Hypokalemia can precipitate life-threatening arrhythmias, especially in heart failure patients taking diuretics. This is more urgent than hypotension or fluid loss. Question 2. A client with chronic heart failure suddenly develops pink frothy sputum. What should the nurse do first? A. Notify the provider. B. Place the client in high Fowler's position. C. Administer prescribed diuretic. D. Prepare for intubation. Answer B. Place the client in high Fowler's position. Positioning immediately reduces preload and improves oxygenation. Medication and provider notification follow, but airway and breathing come first. Question 3. Which discharge instruction is most important for a client starting on digoxin therapy? A. Weigh yourself weekly. B. Check your radial pulse before taking your dose. C. Limit potassium intake. D. Stop taking the drug if you feel fatigued. Answer B. Check your radial pulse before taking your dose. Monitoring heart rate prevents digoxin toxicity complications such as bradycardia and AV block. Question 4. A nurse is caring for a client with end-stage heart failure receiving palliative care. Which intervention best supports patient-centered care? A. Teaching about strict sodium restriction. B. Discussing advanced directives and quality of life goals. C. Encouraging participation in cardiac rehab. D. Increasing IV fluids for hydration. Answer B. Discussing advanced directives and quality of life goals. End-stage care should focus on patient preferences, comfort, and dignity rather than aggressive interventions. Question 5. A client with heart failure is prescribed carvedilol. Which finding requires immediate action? A. Heart rate 52 BPM. B. Blood pressure 138/82 millimeters of mercury. C. Mild fatigue. D. Occasional dizziness. Answer A. Heart rate 52 BPM. Beta blockers like carvedilol can cause bradycardia. Holding the drug and notifying the provider prevents severe cardiac compromise. Question 6. Which assessment finding indicates worsening right-sided heart failure? A. Crackles in lung bases. B. Jugular vein distension. C. Orthopnea. D. S3 heart sound. Answer B. Jugular vein distension. JVD reflects systemic venous congestion, a hallmark of right-sided HF progression. Question 7. A nurse is delegating tasks for a stable client with heart failure. Which task is appropriate for the UAP? A. Auscultating for lung crackles. B. Recording strict intake and output. C. Teaching about fluid restrictions. D. Adjusting oxygen delivery per SpO2. Answer B. Recording strict intake and output. UAP can collect data like INO, but assessment, teaching, and oxygen adjustments are nursing responsibilities. Question 8. A client with heart failure is receiving dobutamine infusion. Which finding is most concerning? A. Increased urine output. B. Heart rate 132 BPM. C. Warm extremities. D. Improved mentation. Answer B. Heart rate 132 BPM. Dobutamine improves cardiac output, but tachycardia greater than 120 BPM signals excessive stimulation and increased myocardial oxygen demand. Question 9. The nurse is monitoring a client with acute heart failure. Which finding suggests pulmonary edema? A. Dull lung sounds. B. Dry cough. C. Pink frothy sputum. D. Barrel chest. Answer C. Pink frothy sputum. This is a classic sign of pulmonary edema and requires immediate intervention. Question 10. Which dietary teaching is correct for a client with heart failure on spironolactone? A. Eat bananas daily for potassium. B. Avoid foods high in potassium like oranges and bananas. C. Increase protein intake to prevent muscle loss. D. Use salt substitutes to season food. Answer B. Avoid foods high in potassium like oranges and bananas. Spironolactone is potassium-sparing. Hyperkalemia is a dangerous risk. Question 11. The nurse receives report on 4 heart failure clients. Which client should be seen first? A. Client with dyspnea when climbing stairs. B. Client with new onset confusion and restlessness. C. Client with 2+ pedal edema. D. Client with BP 150 over 86 millimeters of mercury. Answer B. Client with new onset confusion and restlessness. Altered mental status suggests hypoxia or poor cerebral perfusion, which is more urgent than chronic symptoms. Question 12. A client with heart failure reports dizziness and blurred vision after taking digoxin. What is the priority nursing action? A. Check the client's blood pressure. B. Hold the medication and check digoxin level. C. Encourage the client to rest. D. Offer reassurance. Answer B. Hold the medication and check digoxin level. Symptoms suggest digoxin toxicity. Withholding the drug prevents worsening bradyarrhythmias. Question 13. A nurse is caring for a client with heart failure who has 3+ pitting edema. Which intervention is priority? A. Elevate the client's legs. B. Restrict daily fluid intake. C. Apply compression stockings. D. Increase oral fluid intake. Answer B. Restrict daily fluid intake. Fluid restriction directly reduces overload, preventing worsening pulmonary and systemic congestion. Question 14. Which activity is safe for a client with stable chronic heart failure? A. Shoveling snow for 20 minutes. B. Walking slowly for 20 minutes daily. C. Climbing 5 flights of stairs quickly. D. Jogging at moderate intensity for 30 minutes. Answer B. Walking slowly for 20 minutes daily. Light aerobic exercise improves endurance without overexerting the failing heart. Question 15. The nurse is teaching a client with heart failure about daily weights. Which instruction is correct? A. Weigh yourself after breakfast each day. B. Use different scales but at the same time daily. C. Weigh yourself at the same time every morning before eating. D. Report a weight gain of 10 pounds in a week. Answer C. Weigh yourself at the same time every morning before eating. Consistent daily weights are the most sensitive indicator of fluid balance changes. Question 16. A client with advanced heart failure is prescribed IV nitroprusside. What is the priority assessment? A. Skin color and perfusion. B. Potassium levels. C. Blood pressure. D. Weight trends. Answer C. Blood pressure. Nitroprusside is a potent vasodilator. Hypotension can occur rapidly and must be monitored closely. Question 17. A client with acute heart failure is receiving oxygen. Which finding suggests the therapy is effective? A. Respiratory rate 28 per minute. B. SpO2 improved from 82% to 95%. C. Continued crackles on auscultation. D. Use of accessory muscles with breathing. Answer B. SpO2 improved from 82% to 95%. Improved oxygen saturation indicates successful oxygen therapy. Question 18. Which lab result requires the nurse's priority action in a client with heart failure on loop diuretics? A. Sodium 134 milliequivalent per liter. B. Potassium 2.8 milliequivalent per liter. C. Creatinine 1.1 milligrams per deciliter. D. BNP 1200 picograms per milliliter. Answer B. Potassium 2.8 milliequivalent per liter. Severe hypokalemia increases the risk of fatal arrhythmias, especially with digoxin use. Question 19. The nurse is caring for a client with heart failure who refuses to take prescribed medications. What is the best nursing action? A. Document the refusal only. B. Educate the client about the risks of non-adherence. C. Notify the healthcare provider immediately. D. Ask the family to convince the client. Answer B. Educate the client about the risks of non-adherence. Patient education supports informed decisions and promotes adherence while respecting autonomy. Question 20. A client with heart failure is prescribed IV morphine for acute pulmonary edema. Why is this medication appropriate? A. It reduces oxygen consumption. B. It increases preload. C. It decreases myocardial contractility. D. It raises systemic vascular resistance. Answer: A. It reduces oxygen consumption. Morphine decreases preload and anxiety, reducing the work of breathing and myocardial demand. Question 21. A client with advanced heart failure reports dizziness after standing. Which intervention should the nurse prioritize? A. Educate the client to rise slowly from bed. B. Hold the morning dose of carvedilol and notify the provider. C. Encourage increased daily fluid intake. D. Place the client in Trendelenburg position. Answer: B. Hold the morning dose of carvedilol and notify the provider. Rationale: carvedilol, a beta blocker, can cause orthostatic hypotension. Holding the medication and contacting the provider ensures safety before continuing therapy. Question 22. A nurse must delegate care for a stable client with chronic heart failure. Which task is most appropriate to assign to the UAP? A. Educate the client about sodium restriction. B. Measure intake and output accurately. C. Monitor for signs of pulmonary edema. D. Adjust oxygen flow rate during ambulation. Answer: B. Measure intake and output accurately. Rationale: UAPs can collect intake and output data, while education, assessment, and oxygen adjustments require nursing judgment. Question 23. Which finding requires the nurse's immediate action in a client with decompensated heart failure? A. +3 pitting edema in lower extremities. B. Weight gain of 3 pounds in 48 hours. C. Oxygen saturation of 82% on room air. D. Crackles at the lung bases bilaterally. Answer: C. Oxygen saturation of 82% on room air. Rationale: severe hypoxemia is a life-threatening emergency and must be treated first. Other findings are important, but not immediately life-threatening. Question 24. A client with heart failure is prescribed IV furosemide. Which lab value is most concerning prior to administration? A. Potassium 2.8 milliequivalent per liter. B. Sodium 140 milliequivalent per liter. C. Creatinine 1.1 milligrams per deciliter. D. BUN 18 milligrams per deciliter. Answer: A. Potassium 2.8 milliequivalent per liter. Rationale: hypokalemia increases the risk of life-threatening arrhythmias, especially when loop diuretics are used. Question 25. A client with heart failure reports palpitations after starting digoxin. Which action should the nurse take first? A. Check the digoxin level. B. Assess apical pulse for 1 full minute. C. Notify the healthcare provider. D. Administer supplemental oxygen. Answer: B. Assess apical pulse for 1 full minute. Rationale: digoxin toxicity can cause arrhythmias. The nurse must first assess the apical pulse before deciding further interventions. Question 26. A nurse is caring for 4 clients. Which client should be assessed first? A. Client with HF reporting increased fatigue. B. Client with HF on IV furosemide and potassium ion of 3.1. C. Client with HF with 2+ lower extremity edema. D. Client with HF with a weight gain of 5 pounds in 3 days. Answer: B. Client with HF on IV furosemide and potassium ion of 3.1. Rationale: low potassium combined with diuretic use poses the greatest risk for cardiac dysrhythmias, which can be fatal. Question 27. A nurse is teaching a client with HF about fluid restriction. Which statement indicates correct understanding? A. I can drink unlimited water as long as I avoid sodium. B. I should measure and record all liquids I drink in a day. C. I only need to track fluids if I feel more short of breath. D. I can increase fluids if I urinate frequently. Answer: B. I should measure and record all liquids I drink in a day. Rationale: accurate fluid monitoring is critical in HF management to prevent fluid overload. Question 28. A client with HF on spironolactone presents with muscle weakness. Which lab value should the nurse check first? A. Calcium. B. Potassium. C. Magnesium. D. Sodium. Answer: B. Potassium. Rationale: spironolactone is a potassium-sparing diuretic. Hyperkalemia can cause muscle weakness and dangerous arrhythmias. Question 29. The nurse prepares to administer digoxin to a client with HF. Apical pulse is 54 bpm. What is the best action? A. Administer as ordered. B. Hold the medication and notify provider. C. Double-check with another nurse and give. D. Increase the client's fluid intake. Answer: B. Hold the medication and notify provider. Rationale: digoxin should be withheld if HR is less than 60 bpm to avoid worsening bradycardia. Question 30. A client with HF reports new onset confusion. What is the nurse's priority? A. Reorient the client. B. Assess oxygen saturation. C. Review current medications. D. Notify the provider immediately. Answer: B. Assess oxygen saturation. Rationale: confusion in HF often indicates hypoxemia or decreased cerebral perfusion. Oxygenation must be assessed first. Question 31. A nurse notes frothy, pink sputum in a client with HF. Which action is most important? A. Elevate the head of the bed. B. Notify the provider. C. Administer prescribed diuretic immediately. D. Prepare for intubation. Answer: A. Elevate the head of the bed. Rationale: positioning improves oxygenation and reduces pulmonary congestion immediately, while other actions follow. Question 32. A client with HF has an ejection fraction of 25%. Which intervention is most critical? A. Encourage increased oral fluids. B. Monitor for dysrhythmias and hypotension. C. Provide teaching about low-sodium snacks. D. Administer daily multivitamins. Answer: B. Monitor for dysrhythmias and hypotension. Rationale: low ejection fraction significantly increases the risk of cardiogenic shock and arrhythmias, requiring close monitoring. Question 33. The nurse prepares to teach a client newly diagnosed with HF about weight monitoring. Which instruction is correct? A. Weigh yourself once a week at the same time. B. Weigh yourself daily at the same time in similar clothing. C. Only weigh yourself if your swelling worsens. D. Weigh yourself before and after meals. Answer: B. Weigh yourself daily at the same time in similar clothing. Rationale: daily weights are essential to detect fluid retention early in HF clients. Question 34. A client with HF is prescribed lisinopril. Which adverse effect is most concerning? A. Dry cough. B. Dizziness on standing. C. Angioedema. D. Headache. Answer: C. Angioedema. Rationale: angioedema can obstruct the airway and is a medical emergency requiring immediate intervention. Question 35. A client with HF on digoxin develops nausea and visual changes. What is the nurse's best first action? A. Hold digoxin and notify provider. B. Administer antiemetic. C. Document the findings. D. Encourage oral fluids. Answer: A. Hold digoxin and notify provider. Rationale: nausea and visual disturbances are signs of digoxin toxicity, requiring immediate discontinuation and provider notification. Question 36. A nurse notes that a client with HF has jugular venous distension. Which action should the nurse take first? A. Document the finding. B. Place the client in semi-Fowler's position. C. Increase IV fluid rate. D. Notify the provider immediately. Answer: B. Place the client in semi-Fowler's position. Rationale: positioning helps reduce venous return and improve breathing before other interventions. Question 37. A client with HF is prescribed metoprolol. Which assessment is most important before giving the medication? A. Blood pressure and heart rate. B. Bowel sounds. C. Capillary refill time. D. Level of consciousness. Answer: A. Blood pressure and heart rate. Rationale: beta blockers lower BP and HR. Assessing these ensures safe administration. Question 38. A nurse cares for a client with HF who suddenly develops severe shortness of breath and anxiety. What should the nurse do first? A. Call the rapid response team. B. Place client in high Fowlers and apply oxygen. C. Notify the healthcare provider. D. Administer morphine IV as prescribed. Answer B. Place client in high Fowlers and apply oxygen. Rationale. Immediate positioning and oxygenation improve ventilation while awaiting further interventions. Question 39. A client with HF has been prescribed fluid restriction of 1,500 milliliters per day. Which instruction is best? A. Spread your fluid intake evenly throughout the day. B. Drink fluids only when you are thirsty. C. Limit fluids only in the morning. D. Avoid fluids with meals. Answer A. Spread your fluid intake evenly throughout the day. Rationale. Distributing fluids helps prevent overload and improves adherence to restrictions. Question 40. A client with HF is being discharged with new spironolactone therapy. Which statement indicates a need for further teaching? A. I will avoid foods high in potassium. B. I will not take salt substitutes that contain potassium. C. I will weigh myself every day. D. I will increase bananas and oranges in my diet. Answer D. I will increase bananas and oranges in my diet. Rationale. Bananas and oranges are high in potassium, which may worsen hyperkalemia risk with spironolactone.
If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.